Hi guys, good afternoon. How are you guys doing today? Happy Tuesday. Here we have our amazing Dr. Gurani today.
Hi there, how are you guys? Ready for another live? Alright, let's bring on those questions.
Yes, you guys. So any questions you guys might have, you already know, put them in the chat. And here Dr. Gurani is going to be answering some questions that I'll be making him, okay? So first question, how do you determine if someone needs muscle repair diastasis recti during a tummy tuck?
Gotcha. So the diastasis recti is when because of pregnancy or weight gain, the six-pack muscle separates down the middle, and basically that's the reason to do a muscle repair. Okay, there isn't any other good reason to do it other than fixing and bringing the edges of the muscle back together. And if there is a hernia that's under there, we also fix it. So that's basically the reason why you plicate the muscle. That's why you put it back together.
Oh, great.
So there's a muscle separation.
How do you preserve blood flow to the skin and tissues during an abdominoplasty?
Perfect. So because our anatomy is so well designed by the maker, we have something called a redundant system. That means we don't depend on just one source for the blood supply. We have a redundant system. There's multiple blood vessels that come together and feed the skin. So if one of them gets cut during an abdominoplasty, which is basically mainly the blood vessels that come right through the six-pack muscle, you depend on the blood supply from the side. And that's why I'm very, very strict and careful about the amount of lipo that is done in conjunction with a tummy tuck, because you guys have to understand, when you do lipo, you're also hitting up against some of these blood vessels. Some of them get compromised. So if we are doing very, very aggressive lipo along with a tummy tuck, you can compromise the blood supply to the new incision that you just did, and you can have skin necrosis. So one has to be very smart about, first of all, knowing your anatomy. So you need to find yourself a board certified plastic surgeon that has a good reputation, that has good consistent results, that has the awareness and the knowledge of where the anatomy and the blood supply is. And so one follows the foundation of anatomy and science to deliver good aesthetic results. So a good aesthetic result without blood supply is going to be a complication, and dead skin. And it doesn't matter if you look good for a few minutes and then everything complicates. So what's the point? So the idea is, I know we want to get stuff done. I know we would love to come down to Miami and get everything as much as possible done, but guys, be careful. Please listen to your surgeon. If it's me or anybody else, there is steps that have to be taken for your safety. There's reasons for what I say online or what I say to my patients in consultation. Don't get attracted to these gimmicks or promises of getting a lot of things done in one shot. Okay? Haste makes waste.
Yes. So we have two comments here that say, Gurani is the best, love you, it was a pleasure to meet you.
Thank you so much. It's a pleasure to meet all my patients. I really appreciate my following. The support is amazing, and nothing beats word of mouth, organic followers. That's the name of the game. To be honest and follow the principles of good moral values and sound medicine.
So we have two questions here. Someone is saying hi to you, Dr. Gurani.
Hi there.
And asking, are you double board certified?
Yeah, I have 2 board certification.
Yes.
Plastic and reconstructive surgery, and oral and maxillofacial surgery.
That's amazing, doctor. And we have a question here that says, would you do a tummy tuck and breast lift in one session?
Correct. Yes, that's called a mommy makeover. So I will combine a breast procedure and a tummy tuck at the same time. That is correct. We also can combine it with a small amount of lipo selectively done to stay away from the blood supply, and also the GYN procedure like a labioplasty or a vaginoplasty that can be combined safely with a tummy tuck and a breast. So that's called the Mommy Makeover Plus, and I think that's safe and can be tolerated very well altogether.
So we have a question here that says, if I wanted more hips, would I need another BBL? I'm content with my butt.
Okay, so yes, it's when you transfer fat to the gluteus area, whether it's hips or projection, it's still called a fat transfer. And even though you might be happy with your projection, and I'm not going to try to change it, but what I have to do is when I add more fat to your hips, I still have to feather and contour the back so it doesn't flatten out when I'm trying to enhance the hips. So by pulling on the skin of the hips, I don't want to lose the projection. So I still have to do it, even though it might not be a very large amount, but I still have to sculpt.
I have surgery for Granny on April 2nd.
All right, looking forward to meeting you.
So here we have a question that says, what if I would like to have my bust shaped and lipo out my back?
You can do that.
Yeah.
You can do that. You can do that. Just please give me the opportunity to review your pictures, and also nothing beats the first impression when we meet. That's very crucial. But pictures help. Send me pictures of the front, the sides, both sides. Make sure you're not covering the flanks. Raise your arms up so I can see the profile, and the back picture. This way I can give you a good advice.
So we have a question here that says, what techniques do you use to minimize visible scarring?
Okay, well, scars is what we have to give you to be able to achieve a good result. So we're trading you with a scar in return for a good form and function and aesthetics. Now, we try to put scars, if they're incisions, we try to put them in areas that are inconspicuous, in the relaxation lines that naturally crease, so that your body does not, or your eyes don't catch them, like the inframammary fold, below the bikini line, in areas where there's natural creases. Technically that's the best place for you not to catch the scar. That's one of the ways to avoid obvious scars, and then good technique. Yeah.
Good technique, of course. So we have a question here that says, do you do arm lipo on first round BBL? Because I know you essentially need your arms to get up during recovery, especially it being your first round.
I think that I've combined quite a bit of arm lipo along with BBLs, and I feel comfortable offering it to my patients. My patients seem to do very well. You're obviously not going to be on your own. You're going to have somebody with you, and we will teach you how to take care of yourself here. Now, an arm lift will be very difficult to combine with a mommy makeover or with a BBL, because that's a big incision. But the lipo of the arm is done through small holes, and you should be fine.
So we have a question here that says, is it better to wait to do the lipo after the tummy tuck, since you can only take 1 liter?
So you're correct about the limit of 1 liter. So if you combine a tummy tuck with some lipo, you're allowed to take 1 liter, and you can take advantage of that small amount to shape the waist area. But you're right, if you wait for the true liposuction, I guess that's what they're asking, you're going to get the benefit of having 4 liters removed. So, but which one comes first really depends on the patient individually. If the problem is excess skin, then we should probably address the tummy tuck first. If it's both, then we really have to decide what your priorities are. And there's no cookie cutter here. Everybody's an individual, so I try to help the patient understand and which is the best pathway for them. Sometimes it's both, and we will talk and decide what's your priority. If your priority is having more shape, then we'll go for more shape, because nothing is more powerful than liposuction to give you shape. Tummy tuck, all it really does is remove extra skin. It's not going to give you shape.
Dr. G, I'm 3 weeks post-op and my results are resulting. I thank God for you and your craft.
Thank you so much. I appreciate it, and I'm totally happy to hear that you're doing so well and you're happy with the results.
We have a question here that says, I weigh 125/130. I had 1 BBL round last year. I am not satisfied with my result. Doesn't look like I had anything done. Could I still get another round with you this time?
Sure. I'm sorry to hear that you're not happy. You can send me your pictures, and I will be more than happy to tell you if you have enough fat. I'm sure we'll find something, either arms, upper back, inner thighs. We'll figure something out together to get you to a happy place.
When can you start wearing dresses and sweatpants after a BBL?
I would wait at least a month. At least a month. You don't want to wear something. Dresses are cool from the get go because usually dresses are loose, right? But sweatpants, tights, they can mark you. So be careful. You don't want anything tight to put marks on the abdomen because those marks early on can actually cause indentations that will last and will be hard to remove.
We have a question here that says reverse BBL. Any thoughts about it?
Reversing a BBL? Sure. Reductions, if that's what you're asking, please confirm. If you're asking about taking down the buttocks, yes, I do. I've done a bunch of them and they turn out good. Everybody is an individual. Everybody has the skin stretched out in different directions. But I work with the patient and we'll see how we can get you to a good place. We can do it with Lipo, or sometimes it's Lipo plus removing some skin if there's a lot of skin laxity, especially at the bottom of the buttocks.
So we have a question here that says, how long until you switch to stage 2 faja, and when do you start wearing your foams and boards? I see you March 14th, so excited.
Okay, I'm excited that you're coming on March 14th. I don't use boards, I don't like them, I like foams. They're kinder to the skin and they don't mark you. Second stage faja, I usually don't want it on you for at least, I'm not a very big fan of second stage. I actually like the first stage with the foam and tailored from the sides. But I know patients do it, okay? And just be careful that it's a good brand, it's not too stiff, it's not overly tight because that can cause markings and compromise the skin. So at the least, wait 1 month before you switch over, and please call us and let us know. And if you have the second stage already bought, bring it with you so we can see it. But stick to the first stage plus the foam. The foam can be used on the second day, we will tell you when, and combine the garment with foam and go to a good tailor and take the garment in from the side so that it is comfortably snug, not painfully tight.
Yes. So we have a question here that says, how do you reposition the belly button during a tummy tuck, and what techniques make it look most natural?
Okay, so it's the way I make the cut around the belly button and then open up the new hole for it, that the way I cut it, I make it as natural, as close as possible to the anatomy of a youthful belly button. So, I mean, a youthful belly button looks like a diamond or a circle, and usually I try to stay away from circles because circles tend to contract, shrink, and have they get tighter. So a diamond changes the direction of the stress on the incision, and they tend to look much better and much more natural. Just look at your own belly button and stretch it out, and you'll see what I mean, that it looks like a diamond, not really a circle. So that's what I use. And how do I reposition the belly button? The belly button is a landmark that does not move. The belly button is at the level of the top of your pelvic bone, so it stays where it is. I cut the belly button out by making an incision around it, leave it in its place, and then we dissect the skin up and free it up from the tissue below it, and then pull the skin down, remove the excess, and close the incision, and then I make a new virgin hole for your belly button.
So we have another question from the same girl that got a first round of BBL, and the fat didn't stick. So now she's asking, how do you get the fat to stick and stay in the hip area? The fat in my hips from the first round died. Okay,
so the way I inject is I don't inject under pressure. I use the ultrasound to look at my fat as it's going in, but that's not the reason my fat lasts longer or stays or it integrates better. It's because the fat is being injected in small little bits, in small little aliquots in the areas that we want to enhance, and I'm not pushing it under pressure, and I'm spreading it as evenly as I could to give it the best chance to get the closest to the blood supply and heal and integrate.
Great. So we have a question here that says, can you wear a prom dress after a BBL? I'm going in on April for surgery and prom May 7th. Would that be okay?
I think you're going to be fine. I think you're going to be a little bit swollen, but you can go to prom. Nobody wants to miss their prom.
Of course. We have a comment here that says, thank you for my body. 4 years post-op and I still look great.
Wonderful. That's a testament to good technique, I'm very proud of you. I'm very happy for you, and I'm very happy with my technique. It's definitely lasting, and that kind of complements that question that we had before. How do you prevent the fat transfer from going away? It's because it's how it's placed, the technique of where we're putting it and how we're putting it. We're not shoving it in there. We're not putting it under a huge amount of pressure, and we're spreading it out so that it can integrate better.
Of course. How do you determine the ideal implant size based on a patient's anatomy?
Okay, so if we're talking about a primary augmentation, or for that matter a breast lift, you gotta have an idea of what the patient is looking for. Okay, so that's number one. Then you have to determine where the breast developed. Is it high on the chest wall or low on the chest wall? So that's number two. Number three, I have to see where the dimensions of the breast. So we have the base of the breast. So I have to have an implant that fits within the base of the breast, and the base of the breast is from here to here. And then I want to make sure that there's enough tissue on either side of or all around the implant so that it feels as natural as possible. And then in terms of the height of the breast implant, it also depends on the envelope, so how much flexibility we have and the patient's anatomy, and we have to balance it with their patient's desires. And then that discussion, we have a lot of different sizes of implants, and we reach a comfortable place that, based on her anatomy and her desires, and I will help advise the patient.
Of course. Okay, so here we have a question that says, how do you correct bottoming out implants dropping too low?
You'll probably end up having something called pseudotosis, where the inferior pole, which is from the nipple down to the fold, has stretched out, and unfortunately you're going to have a lift to remove that extra tissue and compensate for it.
So someone's asking here, what is the 12 areas of lipo? Does it include my back?
Well, if you look at where the bra line is, so from the inframammary fold, you draw a horizontal line all the way around, and below that to the waist. Okay, so upper back, no, but from the bra line down.
We have a question that
flanks
says,
included and the front.
Oh, okay. So is there a big difference between regular lipo and HD lipo?
I'd like to say that all my lipo is high definition. If you're talking about seeing the silhouette of the muscle or the delineation of the muscle, that's more on the etching side. The more fit you are, the more obvious your anatomy is going to be, because within the limit of lipo that we're allowed to remove, we're going to be able to enhance that bone muscle junction. But in my opinion, etching is one thing, and high definition is to be able to enhance somebody's figure, to get that hourglass and get rid of all the lumps and bumps that are there because of weight gain, and create that hourglass. I think high definition lipo is getting somebody towards that point, okay? Not to be confused with etching.
So we have a question here that says, Doctor, I had a BBL 3 years ago, and I've noticed 2 balls on my butt when I apply pressure. Can I get that removed?
Yeah, if it's close to the skin, it's possible, definitely. That's usually fat necrosis, and it happens. It's not an infection, it's just some fat scarring, and it can be removed.
So the same girl that's asking, my surgery for April 11th, so I'll be good on May 7th, right? The one for the prom dress.
When is the prom?
So May 7th, and her surgery's gonna be on April 11th.
I think she's gonna be fine.
Okay.
It's almost a month.
So we have
Get a lot of massages.
Yes, definitely a lot of massages. We have a quick question here that says, I want a tummy tuck, but I need my BBL corrected.
Okay, send me pictures, and we'll do the BBL correction first, and then we'll see how your skin behaves. You might not even need a tummy tuck. We'll see. Let me take a look at your pictures, please.
Yes. So we have a question here that says, how do you prevent loss of nipple sensation during a breast lift?
Knowing your anatomy, trying your best to avoid the nerves. It is sometimes you have decreased sensation. That tends to come back, and there is a possibility of loss of sensation or even heightened sensation. So. But what I do is I try not to go too far wide and injure the sensory nerve to the nipple, which seems to irritate patients. It's just being careful. But it does happen where you can lose sensation or get too much sensation. But usually it comes back to normal.
We have a question here that says, how do you correct asymmetry in a BBL?
Okay, so having an eye for it, knowing what symmetry looks like. So if you have an asymmetry where one side is off, that's why you evaluate the patient. That's why you look at them in person through pictures and try to look at landmarks where the pelvic top of the pelvis is, how the flow is between the hips, the buttocks, and the thighs, and try to see if there is a bony discrepancy, if you have a scoliosis or a curved back, or one leg's longer than the other, and try to see if we can figure out a way to get you into harmony and despite what asymmetry you have. Now, if the asymmetry is because of a prior surgery, then again I will point that out to you, and we'll go from there, and we'll try to add to the areas that are deficient, and maybe take away from the areas that are over contoured.
We have a comment here that says, he is the GOAT, highly recommend, have 2 BBLs with him, definitely check him out.
Thank you, appreciate it. Vote of confidence from my patients is the best.
It's the best, of course. So we have a question here that says, how far up is the back is included in BBL?
To the bra line, guys. So it's just logical. If it's from the breast fold down to the private area, then just draw a horizontal line, and it's from there down to the lower back, right above the buttocks.
We have a question here that says, any suggestions on boosting our hemoglobin,
Yes.
doctor?
So you can take iron supplements and vitamin C, B12, folate. The iron supplement that I like, it's a drink from a plant-based, Floradix, Floradix. It's found on Amazon.
We have a question here that says, can you just do Lipo 360 with hip dips, or do you need a BBL?
If we're transferring, it's still considered a Brazilian butt lift. It's a fat transfer, so if you don't want any fat transfer, or if you don't want a lot of projection or any projection, I will respect that. But yeah, still the BBL. If you add to the hips, you have to try to add a little bit to the projection, because what happens is the skin is going to pull into the air, into the direction of the hips, and it's going to flatten your projection. So I have to compensate a little bit. It doesn't have to be a lot, but I have to give you a result where it looks like an inverted heart, round projection with hips, but not taking advantage of the skin and enhancing the hip at the expense of the projection.
We have a question here that says, what's the minimum BMI for a skinny BBL?
There's no minimum BMI. There is, do you have the fat deposits in the correct areas that I can use? So if you can have a small BMI but still have fat around the belly button area, the love handles, the inner thighs, and if you're a small person, you don't need that much fat to give you a dramatic result, because it's really what you take away that makes a difference at the beginning, and the second step is how you put it, how you transfer it. So it doesn't have to be huge volumes, guys.
Yeah, of course.
Even skinny girls can have a BBL.
Yeah, nice booties. Nice to shave. Here, Dr. Gurani will give it to you, girls. So, someone's asking, do you give dramatic if asked for?
Yes. You just have to talk to me. Show me what you're looking for. If I don't think it's logical, I'll tell you. I have no problems being very honest and right to the point. If it's achievable, I will, and I will advise you if it's not advisable, if it's not good for you, if it's going to have a bad effect. For example, let's say you have very soft skin, loose skin, and making your buttocks really, really big, and then eventually drop. You have that saggy diaper look. I'll advise against it. I'm here so that to give you advice so that in the future you have a predictable, stable result and you have no regrets.
So here we have a question that says, are JP tubes only for tummy tucks, or can they be requested for lipo? I want a round tube for lipo, but reopening the incisions for drainage is just too painful.
I understand. The reason I don't use drains is because the drains get clogged up and they don't drain, and we've noticed that the fluid comes out from around the drain, and lipo is discontinuous. There's all these different Swiss cheese tunnels in there, and fluid gets trapped. So I've moved away from drains, but listen, we can talk. If you really are hellbound on getting drains, we'll talk and see if that's something that just works for you.
We have a question here that says, I am getting Lipo 360 April 14th. Can I add fat transfer to my hips?
Yes.
Or do I have to change my procedure?
No, you don't have to change the procedure. It's Lipo 360 with a fat transfer. You can call it a BBL, you can call it Lipo 360 with a fat transfer to the hips. Again, going back to that theme, if I just transfer to the hips, it will flatten your projection. So I do have to feather a little bit. It doesn't have to be a lot, but just to compensate for pulling away from the projection. Okay, but we can talk about it.
Yes, you guys. So here we have a question that says, how long does it take for final breast shape and positioning to settle?
A month, about a month. The skin, the envelope is tight at the beginning, and what happens, the implant has to drop a little bit, and the skin has to accommodate. So you'll see, at the beginning, I try to choose my implant the closest to what I think is going to be as close as possible to what the patient wants. But the skin has to accommodate. Some people have much tighter skin, they haven't given birth or have not breastfed, so those patients have tighter skin. The patients that have had pregnancies and childbirth and so on, they accommodate the implants a lot faster.
We have a question here that says, how do we get rid of the fluid without the drains? Is it through massages?
At the beginning, we're trying to push as much of that fluid out of the incisions. But then it's like when it rains so much and the roads flood, it's very hard to, you see water everywhere. But the lymph nodes get overwhelmed. So what we try to do is to push that fluid out of the incisions as much as possible for about a week, and then it seems that the body can pick up the slack in about a week's time, and it's just by doing good lymphatic drainage massages. And that's why it's important for you guys to spend your time here with us and come consistently to the clinic so that we can teach you how to take care of yourself and how to even help yourself and do your own massages in conjunction with a good massage therapist. And you can actually keep an eye on what they're doing and know if they're doing the right thing for you, because we are going to teach you how the right thing is done.
So we have a question here that says, how long do I have to wait after nursing to get a breast lift?
I would wait 6 months, my dear, because your breast is going to go through so many changes, first during the pregnancy and then when you're breastfeeding. It's going to stretch, it's going to get engorged, you're going to have a lot of skin damage. And I've seen the breast reshape and remodel for 3 to 6 months after surgery, and the whole diagnosis changes. I've actually seen one patient where I thought after she breastfed she was going to definitely need a breast lift, and then lo and behold, a year passes by and she comes back and it was only an implant exchange. So, moisturize the breast, skin, and wait a little bit and don't jump the gun.
We have a question here that says, can you get a BBL with a high BMI?
We have to cut it off to below 40. So again, send me your pictures, send me your height and weight, and I'll tell you how we can work with this, but the cutoff is below 40.
I loved him not doing the drains.
Yeah, the drains, most patients, I would say 99% of patients complain about them, that they are painful and the fluid just drains around them. So I've stopped using them. It's not that hard to pull the incision apart. It's only a small 1 centimeter incision and fluid just wants to flush out.
We have a question here that says, can I self-massage instead of paying or have my partner do it?
Okay, so I want you to self-massage, but that's aside from the professional, because nobody is going to be able to do their self-massage as efficiently as a massage therapist. You can teach your partner, and hopefully they will have the hands and the courage to do it. But guys, if you're going to go through this very serious procedure, you need the assistance of a good massage therapist that knows what they're doing. So try not to be cheap on the recovery, because you will pay the price of being swollen, edematous, and you'll have that fibrosis that we talked about, where the skin gets thicker and doughy because of the fluid that's in there.
Yes, you guys, very important to remember that. We have a question here that says, I'm coming from out of town. How many days must I stay after surgery?
For a BBL, 7 days. For a mommy makeover, 10 days. For smaller procedures like breast lifts and breast reductions, you can stay up to 4 days and leave.
We have a question here that says, how long do we stay after the surgery? Do you spend the night?
you don't spend the night in our facility, but we want you to go to an Airbnb or a hotel. I really don't like you guys going to recovery houses, so we have 9 hotels around our building. Get a companion that is over the age of 18 that's going to be responsible for staying with you all night, and we'll give you instructions on how to take care of yourself. And how long do you stay in town? Like I said, for BBL 7 days, Mommy Makeover is 10 days, and anything smaller than that, we can be comfortable leaving in 3 to 4 days. But Mommy Makeover and BBLs and Lipo, we need you here so we can teach you how to take care of yourself.
Yes, you guys, very important. We have a comment here that says, your BBLs are the best, doctor. I'll see you in 1 month.
See you in a month. Thank you.
So we have a question here that says, does he do Lipo HD, high definition Lipo? Yes, you guys.
Yes, I do.
He does.
Yes, I do. All my Lipo is HD.
Yes.
It's about giving the patient a harmony, no interruptions, no lumps and bumps, as much as possible. If you're confusing that with etching, etching is what you do to bring out the outline of the muscle and going towards athletic look. But that, you have to be closer to your ideal weight. High definition, in my opinion, is cleaning up the torso to give harmony, so you don't have the bra bump, the love handles, and so on and so forth, and as flat of an abdomen as possible. So I call that high definition. But if you have another definition of it, please let me know, and I'll be more than happy to discuss it with you.
So we have a question here that says, just bag Lipo, how long must I stay in the city?
Okay, same thing. If you're doing Lipo, you should, we're not doing fat transfer. I think 5 days is good enough, but we need to have you there, and I'm talking about after surgery. The first day before surgery doesn't count. Day of surgery doesn't count. The count starts the day after surgery. Guys, do not skimp out on your recovery. Don't try to cut corners when it comes to your post-op, because spending time with us is crucial. When you go home, it's difficult for you to get care. A lot of people don't feel comfortable rendering care because they don't know the procedure, or they did not operate on you, so they don't want to help. So stay in town, it's worth it.
So we have a question here that says, after BBL, when can I start driving?
I know you're not going to want to drive for the first couple of weeks, but if you really have to drive, at least try to wait 3 to 4 weeks before you start sitting on that booty for an extended period of time, because you're going to flatten it out. The fat is integrating, and even at that point, you're going to have to put a booty pillow and a pillow behind your back so you can lift up your body and not put pressure on the areas that we fat grafted.
So we have a comment here that says, amazing doctor. And we have a question that says, can I get a tummy tuck scar revision with a BBL at the same time? They've asked me. I know. Let me see it on an individual basis. Mm-hmm.
It's all about blood supply, guys. We do not want to hurt the blood supply and get you skin necrosis. But once you show up here, show it to me, and I'll be more than happy to help you. So I have taken out some scars. But if it's a huge scar, it's not a very smart idea. But usually the tummy tuck scars, most of it is nice, and it's just the area in the middle that is a little bit compromised. And as long as it's just at the skin, it's a possibility.
So you guys, if I missed your question by any chance, just type it again in the chat. It's a lot of questions coming in, so it goes up, okay? But I'm getting to all of them. So we have a question here that says, so what is it when it shows the ab lines?
That's etching. That's ab etching. Okay. A lot of times, if you're close to your ideal weight, they show up by themselves. And a lot of my patients take care of themselves. They massage themselves very well, and they eat well, and they even lose more weight, which is great. And then that anatomy starts showing up, just like going to the gym and working out really well. Your six-pack starts showing. That's what I'm looking for. So ab etching is really preferably for people that are closer to their ideal weight.
How long after I get a BBL can I get my breasts done?
3 months, so that we can comfortably put you on your back without hurting your procedure.
Great. So we have a question here that it was a girl that I missed by mistake. I had a BBL last year with Dr. Harrow, but I didn't get the results I wanted. He said my skin was too tight and it was pushing the fat back out. How can this be prevented for a round 2?
Well, if you've already had a round 1, I'm sure your skin has stretched out, and it's going to probably accommodate better this time. I don't know what the nature of your skin is and your anatomy, so I can't speculate. But you know, what you do is on the round 2, you get the advantage of the stretching that happened from round 1, and hopefully we'll get you to the point that you're happy. But some people do have stronger skin than others, you know.
So we have a question here that says, when can we begin working out after lipo and BBL?
Okay, lipo, BBL, I would definitely tell you to wait 3 months. After lipo, you're not going to want to work out in the first month. It's going to be very uncomfortable. But I want you to be active, walking around and stuff like that. I would say about 6 to 8 weeks, 8 weeks preferably for lipo across the board, and then 3 months for BBL.
We have a question here that says, can I add J plasma to my procedure?
Yes, you can, and allow me to see your pictures, and when I see you in person, I'll tell you if it's going to be an advantage for you. If I don't think it's going to help you, I don't want you to spend money on something that's not going to work for you.
So you guys, this is the last question that we'll be asking Dr. Gurani. Can a breast lift, oh no, I'm sorry. How do you achieve upper pole fullness without implants?
Okay, so if somebody is going through a breast lift or a breast reduction, I use your own tissue. It's called auto augmentation. That means some tissue must be removed, but when I do the breast lift, breast reduction, the breast tissue is divided in a certain way. I don't want to get too graphic, and reshaped. And I will try to move the tissue in such a way that I can favor the top of the breast. Usually patients are talking about the upper pole, the 12 o'clock, and see if I can make that look fuller. And I've been very successful with doing that. You have to, as a surgeon, understand where the fold starts and where the top of the breast is, so that the patient, and explain that to the patient so they can conceptualize the difference between their chest wall and their breast mound. This way they understand why you need implants if you don't have enough upper pole fullness, or how we can work with their own tissue if they have sufficient amount of tissue to fill up the top. Now, if a patient is deflated severely, that's where the implant comes in, because the implant gives me volume issue.
Of course,
Okay.
you guys. So this is really the last question.
Okay, all right.
So what's the
so
main
you're faking me out.
difference? So I'm trying to get them, you know.
No, anything. Just go ahead and
So
let's
what's
help
the-
our audience.
So what's the main difference between J plasma and ab etching?
Okay, J plasma is an instrument. It's a helium gas along with electricity. It causes a plume, and that plume heats up the skin and causes remodeling of the tissue and shrinkage. Okay, ab etching is a liposuction technique where you're defining the lines right above where the muscles are, so that they can appear that they're very athletic.
Yes, you guys. So thank you guys so much for joining the live today.
Thank you for your questions.
If we missed your question, no worries. You can DM us personally to Dr. Gurani's Instagram or Icon Cosmetic Center. We'll get right back with you. Okay, you guys. Thank you so much for joining live today. Have a beautiful day. Happy Tuesday, and thank you so much, Doctor, for being here today.
Thank you for reading those questions.
Bye, guys.
Thank you. Take care. Bye bye.